Dr. Harold Chen had been working the hospital cafeteria for 2 years since retiring from the medical examiner's office. When he overheard conversations about patients who couldn't be saved, his instincts didn't hear medical tragedy. They heard the kind of language that had always preceded his most important investigations. Welcome to the Human Stories. Before we begin this powerful story of hidden expertise and moral courage, tell me in the comments, what city are you watching from today? And if you believe stories like this deserve to be heard, hit that subscribe button. These stories matter. St. Mary's General Hospital served coffee at 5:30 a.m. sharp when the night shift was ending and the day shift was beginning. In the basement cafeteria, fluorescent lights hummed over tables where doctors, nurses, and staff grabbed quick meals between emergencies, surgeries, and the endless rhythm of institutional health care. Harold Chen arrived every morning at 5:15 to start the coffee machines and arrange the breakfast pastries. At 71, he moved with the careful precision of someone who had spent a lifetime paying attention to details others missed. Gray hair, wire-rimmed glasses, and a quiet demeanor that made him invisible to most of the medical staff who passed through his serving line. To them, he was just the friendly Asian man who remembered how they liked their coffee and never got their orders wrong. What they didn't know was that Harold wasn't just any cafeteria worker. For 32 years, he'd been Dr. Harold Chen, Chief Medical Examiner for the county, a forensic pathologist who had performed over 8,000 autopsies and testified in hundreds of cases involving suspicious deaths, medical malpractice, and homicide. He'd developed an ear for the kind of medical language that preceded cover-ups, and an eye for the patterns that distinguished genuine medical tragedy from deliberate negligence. His retirement 2 years ago had been planned. His instincts for detecting medical deception had been permanent. "Morning, Harold," said Dr. Sarah Kim, grabbing her usual black coffee and blueberry muffin. "How's the family?" "Good, thank you, Doctor," Harold replied, but his attention was on the conversation at Table 6, where Dr. Marcus Webb was speaking in hushed tones to 2 surgical residents about a case that had gone south unexpectedly. In Harold's experience, when doctors used phrases like unexpectedly and couldn't have been predicted, they were usually describing situations that could have been predicted by someone with proper training and attention to protocol. "The family's asking questions," Dr. Webb was saying, stirring his coffee with the kind of nervous energy that Harold recognized from decades of depositions. "But the chart documentation supports our position. Sometimes these things just happen." Harold had heard those exact words in courtrooms, usually just before he presented evidence that proved those things didn't just happen. They were caused by specific medical decisions that violated standard care protocols. Over the next week, Harold found himself paying closer attention to the conversations that took place over morning coffee. Medical staff often used the cafeteria for discussions they thought were private, assuming that the elderly Asian man serving food didn't understand the complexity of medical terminology. They were wrong on both counts. Harold understood medical terminology better than most of the doctors he served, and he was beginning to recognize a pattern in their discussions that made his forensic instincts activate for the first time since retirement. 3 unexpected patient deaths in the cardiac surgery unit over the past month, all involving Dr. Webb's team, all described using language that suggested defensive positioning rather than genuine medical analysis. "Chart says the patient coded during a routine procedure," Dr. Webb had said Tuesday morning. "Post-op complications are always a risk. Family understands that." But Harold had noticed something in the resident's body language, the kind of nervous tension that usually indicated someone was uncomfortable with the official story they'd been told to support. On Thursday, Harold overheard Dr. Webb instructing the residents on proper documentation procedures for difficult cases. The conversation included phrases like, defensive charting, and liability protection that had nothing to do with patient care and everything to do with legal protection. By Friday, Harold was doing something he hadn't done since his retirement. He was taking notes, not obvious notes, just mental documentation of dates, times, participants in conversations, and specific language that suggested something more concerning than routine medical complications. That weekend, Harold did what he'd done thousands of times during his career as a medical examiner. He researched. Using contacts he'd maintained in the medical and legal communities, he quietly gathered information about the 3 patients who had died unexpectedly under Dr. Webb's care. Medical records, family statements, and most importantly, the kind of details that official hospital reports often omitted. What he found was a pattern that would have triggered a full investigation if he'd encountered it during his years at the medical examiner's office. All 3 patients had been relatively healthy before their surgeries. All 3 had experienced complications that occurred during specific procedures when Dr. Webb was the only senior physician present, and all 3 had been cremated quickly before families could request independent autopsies. Monday morning, Harold arrived at the cafeteria with more than coffee and pastries on his mind. "Dr. Webb," he said as the surgeon approached the serving counter, "could I speak with you privately for a moment?" Webb looked surprised that the cafeteria worker was addressing him directly. "Is there a problem with my order?" "No, sir," Harold said quietly, "but I think there might be a problem with your patients." What happened next was 32 years of forensic investigation experience compressed into a conversation that would change everything. Harold didn't accuse, he didn't threaten. He simply asked questions in the same calm, methodical way he'd questioned hundreds of medical professionals during depositions. "Doctor, I've been working here for 2 years, and I've noticed some interesting patterns in the conversations I overhear. As someone who's spent 3 decades investigating medical deaths, I'm curious about the statistical probability of 3 healthy patients experiencing fatal complications during routine procedures performed by the same surgical team." Dr. Webb's face went pale. "I'm sorry, who did you say you were?" "Harold Chen," Harold said simply, "retired chief medical examiner, 32 years investigating suspicious deaths, including medical malpractice and homicide cases." The conversation that followed was brief but definitive. Dr. Webb made the mistake of trying to intimidate someone who had faced down defense attorneys, hostile witnesses, and criminal suspects for over 3 decades. Harold listened to Webb's explanations with the same professional detachment he'd used during thousands of interviews. And when Webb was finished, Harold said the words that ended the conversation. "Doctor, I think you should know that I've already documented everything I've observed, and I'll be reporting my concerns to the appropriate authorities this afternoon." That evening, Harold made phone calls to people who still trusted his professional judgment. Medical board investigators, district attorney's office, and colleagues who understood that when Harold Chen said he'd observed evidence of medical misconduct, it was time to pay attention. The investigation that followed revealed what Harold had suspected. Dr. Webb had been deliberately causing patient deaths to cover up previous surgical errors, using his position to eliminate witnesses to his incompetence and protect himself from malpractice claims. 3 months later, Dr. Webb was arrested for multiple counts of murder. The hospital implemented new oversight procedures, and the families of his victims finally had answers about what had really happened to their loved ones. Harold never sought credit for exposing the crimes. He continued working in the cafeteria, serving coffee, and observing the conversations that took place over morning meals. But now the medical staff knew who he really was, and the atmosphere in the cafeteria changed. Conversations became more professional, charts were documented more carefully, and when doctors discussed difficult cases, they did so with the knowledge that someone who understood medical malpractice was listening. "Harold," Dr. Kim said one morning, "I never knew you were a medical examiner. Why didn't you tell anyone?" Harold poured her coffee and smiled. "Doctor, in my experience, people are more honest when they don't know they're being observed by someone who can recognize dishonesty." Word spread quietly through the medical community that St. Mary's Hospital had a unique form of quality control. A retired medical examiner who could identify medical malpractice while serving breakfast. Harold never advertised his background or made a show of his expertise. He just served food, listened carefully, and stayed ready to protect patients from doctors who had forgotten their oath to, first, do no harm. Because that's what you do when you've spent your career investigating medical deaths. You don't stop protecting people when you retire. You just find a new way to watch over the places where life and death decisions are made every day. And sometimes the most qualified medical oversight in a hospital comes from someone who looks like they're just trying to keep the coffee fresh. Harold Chen had spent 32 years speaking for victims who could no longer speak for themselves. Now he spent his retirement making sure that victims were created in the first place. The mission was the same, the setting was the same. The only difference was that now, instead of investigating medical crimes after they happened, he was preventing them before they could claim more lives. And every morning, as he served coffee to doctors and nurses who were genuinely committed to healing, Harold knew that the most important work happened not in dramatic courtroom revelations, but in the quiet vigilance of someone who understood that protecting patients sometimes meant watching the people who were supposed to protect them. So the next time you're in a hospital cafeteria, look at the person serving your food. Remember that sometimes the most qualified medical oversight in the building is provided by someone who spent their career investigating what happens when medicine goes wrong. Have you ever met someone like Harold? Someone whose retirement job put them in the perfect position to use their professional expertise for good? Share their story in the comments below. Tell us about the quiet professionals who never stop protecting the people who need protection most. Thank you for watching The Human Stories. If this story moved you, subscribe and share it with someone who believes in the power of experienced oversight. Because the world needs more people like Harold Chen, professionals who understand that some missions are too important to end with retirement. Until next time, remember that guardians come in all forms. Sometimes they wear white coats and carry stethoscopes, sometimes they wear aprons and serve coffee, but they're always watching for patterns that threaten the innocent, always ready to speak for those who cannot speak for themselves. And sometimes the most important protection in a hospital comes from someone who knows exactly what medical crime looks like and refuses to let it happen on their watch.